Artificial intelligence is transforming healthcare by enhancing diagnosis, treatment, and patient engagement. Recent advances span generative models that interpret genetic variants, AI-assisted clinical documentation, disease detection tools, AI-designed medicines and organs, and new home-based monitoring technologies. This report summarizes the most significant AI innovations emerging around 2025-2026 and explains how they could improve health outcomes, efficiency, and accessibility. In clinics and hospitals, ambient AI captures clinician-patient conversations and automatically generates documentation. Studies show these tools lower cognitive workload, improve ability to focus on patients, and reduce after-hours documentation. After 1 month of adoption, clinicians' note-related task load decreased, and they spent roughly 0.9 fewer hours per day on documentation. Adoption has also been associated with a 74% reduction in clinician-reported burnout. However, developers must address consent and privacy. A U.S. practice was sued after using AI scribes without written consent. Generative AI evidence engines, such as OpenEvidence, link patient data with medical literature to summarize evidence and flag drug interactions. Up-to-date Expert AI, introduced in 2026, offers conversational clinical decision support. Experts note that by 2026, generative AI will increasingly automate documentation, synthesize notes, surface care gaps, and streamline communications. But strong governance will be essential to prevent shadow AI use outside institutional oversight. AI tools for medical education. Intelligent tutors are helping students learn anatomy and physiology, while AI-powered simulation platforms create realistic clinical scenarios. The NCBI watchlist describes AI tools that coach novices and provide feedback on procedures. Ambient listening tools and virtual nursing support help mitigate workforce shortages by capturing information and assisting nurses. By August 2024, the US FDA had cleared more than 950 AI/ML medical devices, most in radiology and cardiology. Examples include Overjet dental radiology software, EchoGo Heart Failure 2.0 to analyze echocardiograms and predict heart failure risk, BrainC to detect early Alzheimer's disease from MRI scans, AI 4510 urine particle analysis system for hematology, EndoScreener for gastrointestinal lesion detection, Assist TBI for triaging traumatic brain injury, and LumeNeuro for retinal biomarkers. A partnership between EchoHealth and Imperial College London produced an AI-enhanced stethoscope that pairs heart sounds and ECG signals with AI interpretation. In trials across 200 practices, clinicians using the device were 2 to 3 times more likely to detect heart failure, atrial fibrillation, and valvular disease early, enabling earlier treatment and reducing mortality. Machine learning algorithms analyze data from wearables and smartphones to track vital signs and predict deterioration. A randomized controlled trial found that remote monitoring with Alea Care's machine learning system improved the prediction of adverse events by 11% and reduced emergency visits by 68% and hospitalizations by 35% among chronic disease patients. Sensors that monitor heart rate variability and other metrics are moving into mainstream health. Advanced algorithms interpret HRV, respiration, and movement to differentiate stress, recovery, and sleep. Medical futurists anticipate the rise of devices that enable blood collection without clinic visits. Early versions allow virtually painless blood collection at home with simple instructions and compatibility with standard lab tests. Autonomous robotic phlebotomy devices, such as Vitestro's CE-marked Aleta RR, use ultrasound to find veins, draw blood, and apply bandages automatically. Although approved in Europe, they remain investigational in the US. Generative models at MIT and McMaster University analyzed millions of molecules to design new antibiotics. 2 compounds eradicated methicillin-resistant Staphylococcus aureus in mice, and 1 showed activity against drug-resistant Acinetobacter baumannii. Mindstate Design Labs used AI to create MSD-001, a non-psychedelic analog that enhances neuroplasticity without causing hallucinations. PopEve is a generative model that integrates deep evolutionary signals and human population constraints to evaluate missense variants, In a study of about 30,000 patients with developmental disorders, PopEve identified probable diagnoses in about one-third of individuals by ranking damaging mutations while avoiding penalizing variants common in diverse populations. Stanford's CRISPR-GPT uses language models to design gene editing experiments. It suggests guide RNA sequences, forecasts off-target effects, and accelerates the design process, making CRISPR-based treatments more accessible. Researchers have engineered lab-grown bone marrow that produces billions of blood cells, 3D-printed lungs with living cells, and custom bone grafts printed during surgery. Scientists also converted a donor kidney from blood type A to type O by enzymatically removing antigens, creating a potential universal kidney that could overcome blood type barriers. A trial of AMT-130, a gene therapy for Huntington's disease, slowed disease progression by about 75%, suggesting AI-assisted therapeutic design may offer new hope. In 2026, NVIDIA and Eli Lilly launched a co-innovation AI lab combining AI researchers and scientists to tackle drug discovery challenges and pioneer robotics to scale medicine production. Dartmouth College conducted the first randomized controlled trial of a generative AI therapy chatbot, Therabot. Among 106 participants with depression, anxiety, or eating disorders, those interacting with Therabot experienced average reductions of 51% in depression symptoms, 31% in generalized anxiety, and 19% in body image concerns. Participants reported trust and communication levels comparable to working with a therapist, though researchers emphasize the need for clinician oversight. Digital health coaches, navigators, and concierge physicians use AI insights and wearables to provide personalized diet, exercise, and mental health guidance, and help patients traverse increasingly complex healthcare systems. Digital twins integrate genomics, imaging, sensor data, and clinical records to simulate an individual's physiology in real time. They are being explored across cardiology, oncology, pharmacogenomics, and neurology. A review in the Journal of Personalized Medicine notes that digital twins could enable dynamic, patient-specific predictions and adaptive therapy, but technical and regulatory challenges currently limit widespread clinical adoption. Waystar's AI engine drafts appeals for denied insurance claims by reviewing medical records and denial rationales, potentially recovering revenue and reducing paperwork for clinicians. GE Healthcare's AI-guided ultrasound uses deep learning to recognize anatomical structures and provide real-time guidance for probe positioning. This technology helps clinicians with limited ultrasound experience capture diagnostic quality images and is being used to improve prenatal care in low-resource settings. Experts expect 2026 to be a year of governance. Rapid adoption of generative AI has led to shadow AI, where staff use unapproved tools. Health leaders must build formal frameworks, training, and guardrails to ensure safety and maintain clinician skills. The newest AI innovations in healthcare are redefining how clinicians diagnose, treat, and monitor patients. Ambient documentation tools and AI scribes are reducing administrative burden. Generative models like PopEve and CRISPR-GPT are unlocking genetic insights and accelerating drug discovery. AI-enhanced devices such as stethoscopes, phlebotomy robots, and remote monitoring wearables are enabling earlier detection and home-based care, and digital twins and therapy chatbots illustrate the move toward personalized, continuous support. As healthcare enters 2026, these inventions hold promise for improved outcomes and efficiency, provided that governance frameworks, equity, and clinician oversight keep pace with rapid innovation.